The next thing I'm going to work with briefly is the knees. And now the most useful thing you can do for the knee is to tighten all around the knee. Now, you don't need to tighten it fully in the beginning. You can just tighten the bit that doesn't tighten enough, and that's usually the hamstring. And so to learn to really tighten your hamstring, one of the things you can do is acknowledge that the hamstring is a muscle that extends the hip or takes the leg back behind you. So to make the hamstring work as a hip extensor rather than the buttocks muscle, which can also extend your hip, you need to turn your thigh inwards. So I'd like you to lean on the right leg, come to the left toe tip, round your back out, and then keeping the lower back lengthened, step back your left leg, shift the weight to the left leg. Now twist your navel towards your right thigh, shift the weight to the right leg, and put your fingers on the top of the hips. Don't move the top of the hips, but now turn your left thigh inwards. Then shift the weight back to your left leg, lengthen the lower back, and I'll turn sideways so you round out the lower back a little bit. Relax your abdomen. It'll look soft and flabby, but it doesn't matter. The more you tighten your abdomen, often the more it restricts the healing process. In many cases, not always, but in many cases, if healing is needed, if you can't breathe into your abdomen, that's one of the worst things that will disable you from healing. So with your lower back lengthened, the weight in the left leg, the abdomen expanded, now shift the weight to the right leg and look at the floor for balance. Bend the right leg for balance, grip with the toes for balance, and then if you can, lift the left leg off the floor. And you could be holding a wall with one hand, but then with the hands on the hips, practice turning your left thigh in and out. Notice as I'm doing that, my left hip is not moving. See, where my fingers are is not moving. And if you can do that, so to the knee turns in and out, when your knee turns in, your buttocks should relax and your hamstring should release. When you turn the thigh out, the buttocks should harden and the hamstring releases. Now, these are really important exercises because when you turn your left thigh in and you release the buttocks, that will open up your sacroiliac joint, which is the source of a lot of lower back pain. And it can instantly relieve people's lower back just by standing like this, rounding the back out and turning your left thigh in. You get relief of the left lower back. Around the sacrum on the left side, between the sacrum, the fused part of the lower spine, and the outer left hip. At the same time, the hamstring, the back of the leg, that becomes very firm. And that often is a problem for many people with knee problems. Okay, then release it, bring it back down, and just see how your knee feels. If you compare left knee to right knee, if you just maybe try again, how does it feel to squat? Does your left knee feel a little bit better? You can go a little bit further if you wish by tightening more muscles around the left knee. So let's try that. We go, take the right leg forward, come to the left toe tip, round the back out, shift the weight from the right leg and lean back with your left leg. Turn the navel to the right, shift the weight to the right leg, and with the hips level, turn the left thigh in and shift the weight back to your left leg. Keep the lower back lengthened, and then shift the weight to the right leg and look at the floor for balance, grip with the toes for balance, bend the knee for balance, hold the wall if you wish, and lift up the left leg. Then from there, the hamstring is tight. If you turn your left thigh more inwards and push your left thigh to the right, that will tighten the inner thigh more. And if you now pull up your kneecap, that will tighten the front of the thigh. So pulling up the kneecap, you have to do consciously. If you spread your toes, pushing away the base of the big toe, that tightens the calves. And then pull the outer foot to the knee, it tightens the outer calves, like in the ankle exercise. Now, it's important you breathe into the abdomen. And the more you bring the left leg to the right, the more it releases the tension on the outer hip. And that can often cause a problem in your hip. So here now we're not just releasing the lower back and the knee, we're also releasing some hip problems. Then release. Now, once again, just test how your knee feels if you lower the hip down. How does it feel if you squat half or full? Does the left knee feel a little bit more comfortable, perhaps? Test and see if it's been helpful. Not every exercise I offer is useful for everyone, but I'm giving the things that help most people most of the time. You could also test, if you wish, in a cross-legged position and see if you bring yourself to cross-legged and bend forward slightly, does your left knee feel a bit more comfortable than your right knee perhaps, or than it was before? Maybe change cross-legged so the other leg is in front. Bend forward and backward a bit. Does your left knee feel a bit more stable? You test and see. And then stand back up. Let's do the right leg. So to stabilize the right leg, first of all, practice activating the hamstrings. So shift the weight forward onto your left leg. Come further forward with your right leg to come to the right toe tip. Then round the lower back out. And then slide back your right leg. Take the weight on the right leg and bend forward with your spine. Twist your belly button to the left. And then shift the weight to the left leg, come to the right toe tip. Keeping the hips level, maybe using your hands on the hips to help. Turn your right thigh inwards. Then look at the floor for balance. Grip with your left toes for balance. Keep the left knee bent for balance and lift the right leg just a little bit off the floor. Now if you test, it will mean that the right hamstring is automatically firm when the hips are level. Now, if you turn your right thigh out and in, we can try that. Notice I'm not letting my right hip go up and down like this. I'm keeping the top of the hip, the iliac crest level, and turning my right thigh out and in. And what you should feel if you do this, that as the right thigh turns out, the buttocks goes hard, hamstring goes soft. When you turn the right thigh in, buttocks goes soft, hamstring goes firm. Now, the benefit is that when your thigh turns in and your buttocks releases, that can traction or release the sacroiliac joint, which is the source of a lot of lower back pain and a lot of nerve discomfort, a lot of stress in the body. Because around this region, the parasympathetic nervous system nerves come out. So then when you turn your thigh outward, it actually tightens that region and can often stabilize the back of the hip and release tension at the front of the hip. So not that one exercise is right or wrong. When you turn your left thigh in, that can release lower back problems. When you turn your left thigh out, so your right thigh in, it releases the right lower back. When you turn your right thigh out, that can relieve the front of the right hip and stabilize the back of the hip. When you turn your right thigh in, it also tightens the hamstrings and inner thigh, which can help give strength and stability to the back of the knee. The back of the knee is firm automatically here, but if you take the right thigh to the left like this, you'll feel the inner right thigh becomes firmer and the outer right thigh lengthens and relaxes, and you can release a lot of outer hip tension in the outer hip, which can actually relieve knee tension. If you've got knee pain, sometimes the outer hip is a problem in situations like patellar maltracking. And then to get the whole knee firm, consciously pull up your kneecap. Make the front of the thigh firm by straightening your knee and activating the front thigh. Then spread the toes and pull the outer foot to the knee. Then all the muscles become firm around the knee. So you pull up the kneecap to tighten front thigh, turn the right thigh in to tighten the hamstring, move it to the left to tighten inner thigh, spread the toes to tighten the calf, outer foot pull to knee to tighten outer calf, then lengthen the back and breathe into your abdomen to relax your nervous system and allow the healing process to take place and blood to flow. Then release, bend the knee and come back to standing. Just move your legs back and forth. And then again, see, how does your knee feel now? Has it made your body warmer? Because this really moves blood. The other thing this does is when you take the leg into this turned in position is it releases the psoas muscle. And the psoas is the muscle at the front of the hip that becomes very shortened when we sit for prolonged periods of time, and it can become the source of a lot of lower back pain. So when you do this exercise of extending the hip, so taking the leg back behind you, what you want to make sure of is you're not arching the back as you lift the leg up, because that will just squash the back. That's why I'm asking you to come to the toe tip first, making a conscious forward bend so you lengthen the skin of your lower back, then take the left leg back. And then what you do is you release the front of the hip. And this can be a really good way of releasing lower back pain. So you may feel in your body now, how does it feel to just walk a little bit? Do your hips feel a bit better? Does your knee feel a bit better? Does your ankle feel a bit better? And maybe test, go down and up. Does your lower back feel a bit better? See how it feels. It'll be different for everyone. And do you feel warmer?